I am Lisa Hinkle, Director of Education at SHSMD, and I have the honor of introducing our next breakout session titled Smarter Together, Influencer Marketing, TikTok, and Other Digital Tactics to Shape Up Your Marketing Mix. This session is sponsored by Wax Custom Communications, an award-winning marketing and advertising agency that specializes in healthcare marketing for hospitals, health plans, and more. It is now my pleasure to welcome our presenters. Amanda, Bill, and Craig, the floor is now yours.
Thank you so much. Hey everybody, my name's Bill and I am the president of the healthcare marketing agency called Wax. I'm excited to be here today with you, and we specialize in digital marketing, advertising, and media, all in the health and wellness space. They call us the monster in healthcare marketing because we win loads of awards, but awards are great. That's not really our primary motivation. It's absolutely great, like you all, to wake up in the morning knowing that your work helps people. It connects them with the tools they need to live their healthiest lives. So today I have Craig Fairfield, as said, our managing director, and Amanda Herriman, our marketing manager, with me. We're going to share some stories with you. We'll also give you some strategies and hopefully inspire you to find ways to shake up your marketing mix by using some of the latest digital tactics. That's why we're here, right? The world's gone digital. You can't appease the leadership anymore by putting up a couple billboards and maybe some print ads. You need new tools also beyond paid search and Facebook. You might be using some of these things already that we're going to talk about. If not, you've definitely heard of them. And we'll be talking about everybody's challenge in the future. It becomes more difficult to target and track your specific audiences. With all the changes coming, it's more important than ever to continue for you to collect your first-party data and to add to your CRM. That seems to be the holy grail of the future. Speaking of which, the future, we know when you throw around words like influencer marketing and hyper-targeting and geofencing and TikTok, it might start to get a little future speak to some of your peers and bosses. Health systems and hospitals tend to be laggards compared to other industries in terms of marketing. But this isn't the future, it's right now. So let's get started making the best marketing mix we can.
So the fifths are jumping. Audiences are on the move, and most of them have phones in their hands while they move. With so much information at their fingertips, it's harder and harder to get their attention. We have to meet them where they are and give them reasons to engage with us.
And all of this has become even more urgent recently. You've heard cookies are going away, right? Not Chips Ahoy. I think those are here to stay, but the other kind of cookies, the ones that make digital marketing work. That's a game changer. This change only affects third-party cookies, fortunately, so you'll still be able to track basic data about your own website's visitors. But if you're running digital ads, you'll need to be ready to rethink tactics retargeting. And people are more interested than ever in online privacy. Almost half of the smartphone users in the US are on iPhones, and fewer than 15% of them chose to allow app tracking during the latest iOS update. That's going to be a big problem for Facebook and anyone who advertises there, and it makes everything more complicated. People are more likely than ever to use ad blockers, VPN, and other tools to protect themselves from hackers too.
Well, the good news is digital and traditional marketing paired with great communications and a very good web experience still works, and it works very well. The trick is to find the right combinations of tools and tactics so that you can reach your audience with your messages and engage with them. And that's what we're going to be talking about. We're going to focus on some recent examples of how we used influencer marketing, hyper-targeted strategies, and TikTok to help some of our clients connect with their audience. Let's talk about influencer marketing first.
So the first name that pops up for many people when they think of influencer marketing is Kardashian, right? And the Kardashians didn't invent it, but they may have been the first to perfect it. Next would probably be a superstar actor or a musician, maybe The Rock or Taylor Swift.
Actually, Craig, the person with the biggest following online is the global soccer star Ronaldo. He has almost 500 million followers across Twitter, Instagram, Facebook, and YouTube.
How many? 500 million? That's crazy. And it has absolutely nothing to do with how influencer marketing can help a health system find patients or promote population health. Well, before the internet, some of you guys remember that. In the old days, when we just threw rocks at people to get their attention, we had Uncle Al and Aunt Millie. They were the people we asked for advice. Uncle Al could help us get a deal on a scratch and dent washing machine, and Aunt Millie was a nurse, so we called her when somebody had a fever or a weird rash. We trusted people like them to tell us what we needed to know.
That's what influencer marketing really is. It's building trust. It's the next best thing to having Aunt Millie on speed dial. And it's a tactic that's growing like crazy. According to a longitudinal survey of branding, PR, and marketing professions conducted by Influencer Marketing Hub, $13.8 billion, $13.8 billion, are you guys listening? Will be spent on influencer marketing in 2021. That's up 212% from $6.5 billion just 2 years ago.
That's a lot of money. Okay, this isn't a picture from the family vacation I took a few weeks ago, but it could be. We took a lot of pictures. We posted a lot of pictures. We commented on the pictures we posted of each other taking pictures. We watched our shows, we read the news, we checked the weather. Some of us even worked. We spent a silly amount of time looking at screens, and we're not unusual. In 2018, for the first time ever, people reported spending more time with digital media than traditional. COVID accelerated that even further. We now spend almost twice as much time with digital, and much of that is spent on social media. Now, during COVID, between March of 2020 and March of 2021, screen time went up 50% for kids, and adults now spend almost 8 hours a day looking at one device or another. So, if you want your message to be heard, you have to go where the audience is, and that's online.
Well, let's take a look at some real-world examples, starting with our friends at ChristianaCare.
Hello, I'm Karen Brown, Vice President of Marketing and Communications at ChristianaCare.
And hi, I'm Lisa Maxwell. I'm the President of the Medical Group here at ChristianaCare. So Karen, we were talking about 2020 being a year like no other. We've always had our mission to be that of serving our neighbors, but this year, even more important, people really were coming to us as the source of truth for information about the virus itself, all the way to vaccine, which has really been our business so far.
Absolutely, Lisa. Communications were nonstop this year about COVID and the vaccine. When then President-elect Joe Biden got his vaccine on December 21st at Christiana Hospital, it was a terrific day. It was a great day to celebrate the end, hopefully, of COVID-19. We were really excited to be able to showcase that across the nation. But the task in front of us was really to make sure that everyone, particularly in our community, knew the importance of getting vaccinated. It was a real challenge.
And that has been a challenge, to make sure that people understand that the vaccine is safe and effective, but that they also understand their component, and that we do want people to come and get the vaccine who may be a little hesitant, and reach out to those communities who may not have always, our campaigns in the past have maybe not always reached.
That's right, Lisa. So we reached out to our partners at WACS to really come up with an awareness and a receptivity campaign that was like no other. We did some influencer marketing, and we've done this before with great success in our flu vaccination campaign. So we're really excited about this campaign. It's in addition to our other tactics that we have in our plan. We're seeing measurable results, and we really appreciate the great work that our WACS team has done for us.
As Karen mentioned, we used influencer marketing to help ChristianaCare promote the flu shots and later with the vaccine.
We got great results too. ChristianaCare has a great relationship with two-time Olympian and WNBA superstar basketball player Elena Delle Donne. She's the one on the right. We used her to encourage people to get their flu shots. Now, you probably don't have easy access to superstar athletes with 460,000 Instagram followers like Elena, and that's fine. The real key to the success of this campaign was our use of much smaller influencers. In this case, that meant finding people in ChristianaCare's service area whose audiences included the people we needed to reach. Young moms, for example, who make the healthcare decisions for their households.
We partnered with several people like Living loving Laura, shown here on the left. She's an influencer, she's a nurse, she's a mom. She's also a blogger with a small but loyal following in the area. She posted content about why she chose to get the flu shot and why she chose it for her family. Our influencers also debunked some common misconceptions and gave their followers the encouragement that they needed.
Notice that Laura got a lot more engagement than Elena on these posts, even though Laura's audience is much smaller. Elena's post, however, was watched more than 30,000 times. Keep this in mind when you think about your own influencer marketing strategy. Are you trying to create discussions, or do you just want to maximize exposure? Either is okay. Then choose the right kind of influencer for the job.
If you take a look at both posts, you'll notice we use the hashtag #NoFluCrew. That's a great way to tie influencer content together across audiences and to link them up with your other digital and traditional tactics. We use that hashtag on everything related to this campaign. The lesson here is this: you don't have to have a superstar or pay superstar money to effectively use influencer marketing. You just have to find the right fit.
Well, that sounds a little tricky, and it gets even trickier if you're looking for specific parameters.
Karen and Dr. Maxwell mentioned that we're now using influencer marketing to promote the COVID vaccine to reluctant audiences. Those audiences, they skew younger, they're lower income, and they're heavily African and Latin American. They're also more male than female, and they have to live in or around Northern Delaware in ChristianaCare service area. It isn't easy to find an influencer who fits all of those descriptors, but fortunately, we have technology that can help. Using a platform called Find Your Influence, and by doing some good old-fashioned sleuthing, we identified influencers who made sense, including Dion Davis, a football player at the University of Delaware, and Aisha Marie, a lifestyle blogger who lives in the area.
Dion has 147,000 followers on TikTok, which is his main platform, and many of them are men 16 to 24. That's one of the key audiences we're after for this campaign. Aisha has a total reach of almost 25,000 across multiple platforms, and her audience splits pretty evenly between men and women, and she skews toward the under 25 set too. They both have really strong appeal and credibility with the African American audience. We also selected several Latinx and Hispanic influencers for this campaign, since that's another group who are less likely to have been vaccinated for COVID. And that's the key, really. Choose your audiences and then use technology to find influencers who they'll identify with and trust. Then let them do the talking, just like Uncle Al did back in the day. There are multiple platforms you can use to find influencers. Here's how they work.
So we do a lot of this kind of work for our friends at Community Care Plan, and you're going to meet them here in a minute. But they provide health insurance for kids under a program called Florida Healthy Kids, among other things. And for this particular campaign, we wanted to find influencers who had a strong following with moms in South Florida in particular, which is where Community Care Plan does business. So what we did was use the platform called Find Your Influence, and we searched for some influencers that might work with the campaign. After putting certain criteria into the filters, we had multiple options, including the ones that you see here. We can see each influencer's total reach. That's how many followers they have across all channels where they're active. And we can also see where they are and what categories they're into. For example, fashion, it could be food, whether they're a mom blogger or health topics.
We really liked Jessica Perez. She's on the right here. She goes by Young at Heart Mom online. She has a reach of 47,000. You can see that her audience is 94% female and mostly between 26 and 39. That's exactly right for this campaign. She also has a strong following with both white and Hispanic women, which makes her also a great fit here.
So yeah, that's perfect. So one of the other cool things about this platform is that it actually shows us where each followers, where they are located, the influencer's followers, not just where the influencer live. This is a critical consideration. We don't want to accidentally hire an influencer who might live in Fort Lauderdale, Florida, but mostly has followers in Fort Worth, Texas. This is the internet, right? So we're not tied to a location. So it's critical to have this data. The map that you see here shows us that Young at Heart Mom, she has followers in Southern California and in New York City. Plus, she has a heavy concentration in South Florida, which was perfect. Platforms like Find Your Influence work like middlemen. You can use them to choose influencers. You can hire them through them. You can pay through the platform itself. And they also give you dashboards so you can keep track of how each is doing, making sure that you're keeping track of your ROI. When you hire an influencer, they make and they'll post the content, they'll create the content, and it'll all be housed within the platform. But it allows you, because of the platform, it allows you to give them the direction that they need to approve everything before it goes up. Many will make their own videos, or they'll take their own photos to enhance their posts. Typically, what you'll do is you contract for a certain amount of posts that you agree on beforehand, you agree with them, and then during a certain amount of time. So you give them a time frame, you ask them, you tell them what channels, based on what they have available and what their following is, you work those details out with them on the program itself. You communicate that information and you set the program. Influencers, they usually tell their audiences, they speak directly to their audiences, and they'll post sponsored content that it'll show that way on their channels.
So working with Jessica and a few other influencers with similar audiences, we were able to serve more than 53,000 impressions in a few short months. Those messages encouraged healthy habits and talked about the importance of pediatric care. They also promoted Community Care Plan and Florida Healthy Kids as a solution for moms who wanted affordable health insurance so their kids could get the care they need to stay healthy. The engagement was very high, about 25%, and that's pretty amazing. And that's really the power of this kind of a campaign. When you start with an audience and you use an influencer who has a real connection with that audience, people pay attention and they engage. Okay, so we promised you some actionable ideas. Here's what you should do when you're ready to get started with influencer marketing. As we said, start with the audience. You have to consider them first. Then choose a platform or a partner. Find Your Influence is only one of half a dozen or so similar self-serve platforms. You can use those on your own, or if you have an ad agency or a PR partner, they probably can help you get going with this too. Then assign a budget. It doesn't have to be a huge budget. You can start with a pretty small one and then see what works and work your way up from there. Then jump on that platform or partner up with your partner and search within the criteria to find the influencers who you think will resonate with your audience. And then just try it out. A lot of this right now is about experimenting, seeing which influencers work the best for you and seeing what kinds of messages really make sense to your audience. And remember what Amanda said a minute ago about hashtags. It's very important to use hashtags thoughtfully so you can tie everything together. Never think about this tactic in a vacuum. It has to be part of your marketing and communication strategy so you can use it to amplify everything else that you're doing.
Thanks, Greg. Appreciate it. All right, let's move on. Let's talk about turning this thing inside out a little. Let's talk a little more about hyper-targeting and how to get hyper-targeted. Influencer marketing is all about putting messages where our audience already is. But what if we do it the other way around? You're familiar with the idea of target marketing. It's how to minimize waste coverage and get the best results for your budget. Today's technology makes it easier than ever before. I said easy, but it can still be challenging. So let's hear from our experts.
So using technology, we can actually target down to the block level or even to the individual's level. We can also target based on a combination of things like where someone is, how often they're there, what they're doing while they're there, plus other factors like in-market signaling.
And everything we learn about our audience online can often be reverse attributed to. That means we can turn it into physical addresses for direct mail campaigns. We can match it up with other devices they use or that are used in their household, that kind of thing. That lets us really serve more impressions to the people who need to hear from us and waste less time and money on people who don't. And that's the value and the real strength of this hyper-targeted strategy. And we've been doing variations on this tactic for a while, and it works great. Let's talk about one of those specific campaigns.
Hi, I'm Suzanne Tamargo. I'm the Director of Communications and Marketing at Community Care Plan. We're a health plan that takes care of families and kids across South Florida through programs like Medicaid and Florida Healthy Kids. Unfortunately, the people who need us the most can be pretty hard to find. A great example of that, and one we've had recent success with, is women who just found out they're pregnant. They may be eligible for Medicaid, but they often don't even know that. So we call ourselves the health plan with a heart, and we wanted to make sure that these vulnerable women could get the prenatal care they needed so they could deliver healthy babies. We needed a way to connect with this audience at just the right moment. So WACS designed a strategic plan that used geofencing to find these based on key insights into their behavior, and then delivered targeted digital marketing to reach these women. And this clever solution, combined with other tactics, resulted in a big increase in brand awareness for us. We even outperformed our national competitors in several categories. But more importantly, it connected us to many soon-to-be moms so that they could get the coverage and the care they needed at a critical time. And I'll let my friends at WACS tell you a little bit more about how it works.
Okay, perfect. So, like a lot of good stories, this one is kind of a mystery. Community Care Plan needed help finding women who just discovered they were pregnant. And ideally, we needed to find them in just a few weeks of that discovery.
Yeah, pregnancy automatically qualifies women who fall within certain income brackets for coverage under Medicaid. And that means they can get prenatal care and have healthy babies. Community Care Plan offers that kind of coverage, but there's a lot of confusion within the marketplace about who qualifies. We needed to get information in the hands of the right people, but we had to figure out how.
The pathway, let's call it a consumer journey, seemed pretty clear, and this is how it goes. I might be pregnant, so I'll go to the drugstore and I'll get a home pregnancy test. Oh, it looks like I am pregnant. I need to know for sure, but I don't have health insurance for a doctor visit, so I guess I'll go to the free clinic down the street. Bingo. Our audience would be at a pregnancy resource clinic during their first trimester of their pregnancy. So we found about 20 locations in Community Care Plan service area that fit that description. 17 of them were mappable using the geoframing technology that we have.
That insight was really the key to the success of this whole campaign. We drew digital perimeters around those mappable locations, and then we collected de-identified device IDs from people who visited them once or twice in a 2-week period. Anyone who was there more often than that, we assumed, was probably an employee. Only people who accessed an app while they were there were mappable, by the way. But we assumed many people would, and they did. I mean, what else would you do while you're waiting in a doctor's office?
We created the campaign you see here and delivered a variety of digital messages to everyone who fit the criteria. Remember, we can also reverse attribute those device IDs to laptops and tablets used by the same person. The messages were gentle. We didn't want to say, "So you might be pregnant?" That would be alarming. All we wanted to do was encourage our audience to explore the coverage that might be available to them. And they really did.
Yeah, they did. In combination with other tactics, this campaign was a huge success. Community Care Plan has seen a year-over-year membership increase of almost 30%. And just over the past year, their Medicaid enrollment grew 3.5% faster than the average for all the plans in their area, even beating giants like Humana. And remember those women who needed coverage for prenatal care. In the first 12 months of this campaign, Community Care Plan had a year-over-year increase of 28% in the number of covered births.
Thanks, Craig. That's a great story, Craig and Amanda. And it's a really good result. But what happens when we kind of remove the geographic limitation? Maybe we're looking at a much larger geography. Can we hyper-target those audiences also? Well, we've done some work for our friends at Nestlé, and they have a health science incubator, believe it or not, and we're going to learn a little more from Dr. Mary Christ.
Hi, I'm Dr. Mary Christ, Global Medical Leader of Nestlé Health Sciences eHealth Incubator. Nestlé Health Science is a leader in nutritional research and products across a wide range of medical conditions. Cancer is one condition in particular where we are deeply invested in bringing optimal nutrition to as many patients as possible, because studies show that personalized nutritional counseling can make a key difference in cancer outcomes. For this reason, we developed COPES, Cancer-Oriented Personalized Eating and Emotional Support, a digital platform which provides expert nutrition and wellness support to patients at their convenience. Unfortunately, many patients with cancer are simply not aware of the vital link between optimal nutrition and their outcomes. So we engage with WACS to connect with patients and make them more aware of how COPES could help them.
As with the previous campaigns, this one really started with insights into the audience. We really needed to figure out who would benefit the most from a product like COPES that offers an online cancer nutrition solution. We suspected that one of those audiences would probably be people who live in smaller towns that are a full day's drive, or that would take a full day to go into the city, get face-to-face nutrition, counseling, and advice, and then drive all the way back home. We thought they would probably react the best to a product like COPES that's a pure online solution. So we started looking for places that fit that description.
So we literally took a map and we did a 50-mile radius around each of these mid-sized markets. And then we looked at the gaps around the radiuses and found towns that fit that description. They were about a day's drive from the center of these mid-sized markets. And then based on that information, we chose Evansville, Illinois, Somerset, Kentucky, Decatur, Alabama, Knoxville, Tennessee, Sikeston, Missouri.
People in Evansville are going to be mad at you. You put them in Illinois instead of Indiana, but that's okay. Yeah, these people need COPES and they need cancer nutrition advice because there's a definite connection between that, maintaining a healthy weight, and better outcomes when it comes to cancer. So we tested out this campaign on these 5 different markets based on people sending off other signals that suggested that they needed cancer information, and then geographically locating them in these towns. The messaging was all about skip the trip. That's what we called this campaign. So we put digital messages both on Facebook and using the Google Display Network in front of these people that really just pointed out you can get this product without having to drive to Nashville or Louisville or Indianapolis or St. Louis, and that you should. And these digital ads pointed to a landing page that helps people really understand the connection between cancer and nutrition, and then help them see how they could engage with the platform. It worked really well, by the way.
We had a...
Go ahead.
No, go ahead. I'm sorry.
We had a 69% higher click-through rate than the industry average, which is amazing. And that's a great example of how hyper-targeting can work. That means we put exactly the right kind of message in front of people who really needed that information, and they clicked at a crazy high rate. That's the power of hyper-local, targeted, geographically targeted, pointed messaging.
So you took the thought from my head. That's exactly what I was going to say. All right, so this is more complicated than influencer marketing, but getting started with hyper-targeted tactics can happen a bit at a time. When you're ready to go, consider a few of the following things. First, you need to know the terms. Make sure that you read up on what it is that you're doing before you get involved in anything, right? So understand the difference between geoframing versus geofencing. Look up different tactics that are specific, like Google local ads and what they're for versus Google display or paid search campaigns. Very important to decide where and when you can find your audiences. So do your homework, make sure you go through your consumer journey and really find those windows of opportunity where this kind of a tactic really makes sense. And that'll also help you with the messaging that you need to create. Consider which audiences and current campaigns to start with. So, again, thinking about that journey, think about that messaging and the flow of it so that you can build a campaign that tells a story and really resonates with your audience. And then you want to find a technology platform or partner if you need to. So going back to the first one, understand your terms and understand the offerings before you get involved with a technology partner. This way that you're informed and you know exactly what it is that they're offering you. And you have enough information to make a decision. And the most important thing here is, go ahead and start small, but do remember to test, and test. You're going to want to keep testing and optimizing, and you're going to learn information along the way that will inform the next iteration of your test. So it's a lot of fun for data nerds like me and Craig and Bill. I'm sure a lot of you on the call are data nerds as well. So go ahead and jump into this.
Great. Thanks, Amanda. Well, here it is. This is the coolest part, I think. I mean, I actually personally got the agency into TikTok because my 17-year-old daughter at the time was enthralled with it, and we started doing TikTok. So this is a fantastic medium. If you think about it, you probably thought, okay, these are like kids dancing and lip sync videos, and there's definitely a lot of those, but there's a lot more too. So let's talk about that.
So actually, TikTok is one of the most popular apps in the world right now, and it's the fastest growing. It's been downloaded more than 2 billion times, and in the past 18 months, the number of US adult TikTok users grew 550%.
Incredible.
And, I know, it's quite a number. And if you're not already on it, if you are, you know this, it is crazy addictive. 90% of TikTok users access the app every day, and they spend a whopping average of 52 minutes per day on there. It's like a hole, it sucks you in. If you've never used it though, you may wonder what makes it so attractive. And well, it's really a different kind of format. The content is different, and it is mobile first. It's completely designed for the cell phone, for the mobile device. All the content is vertical, it's phone friendly, it's all video, and it's short format video, which allows us to consume more in a certain amount of time, which is part of what makes it so addicting. And what makes it engaging is it's just so much more engaging than other social media platforms because of all these things, because of the format and because of the constant information that's being thrown at you. And if you think it isn't for healthcare, well, think again, because major hospitals are using it already. And so are organizations like the American Heart Association, which has raised thousands and thousands of dollars strictly by using TikTok and doing campaigns that really have taken off and gone viral. So it's something that we definitely want to talk about now.
I see in the chat that Tara Ricks Edger just jumped off to go look at TikTok. I suspect we just lost about 20% of our audience. No, hopefully not. So, like a lot of social media, it's not just organizations. There are individuals who are making a name for themselves on TikTok, and they're finding giant audiences. It actually is kind of staggering. These are a couple of people who are finding huge audiences while working within the sphere of health and wellness. Dr. Tessa Comer's on the left. She's a pediatrician who's based in Seattle, but she's also a blogger and a TikToker. She has 1.5 million followers on TikTok. Her content is really simple, and it mainly focuses on answering awkward questions for teenagers about stuff like puberty, sexuality, sexually transmitted diseases, other potentially embarrassing topics. And she gets crazy engagement from her audience. She gets comments, she gets likes, she gets tons and tons of views, and her posts are really simple. The post that you see here in the screenshot is pretty typical. She just talks, answers questions, and sort of makes light of otherwise embarrassing subjects. And maybe that's why people really pay attention, because their audience appreciates that. It's not some doctor telling them what to do. It's not some authority figure. It's somebody they can really feel like they have a connection with. Now, Dr. Mike on the right is also a pretty cool guy. He has almost 600,000 followers on TikTok, and he talks about healthy living, but he also just talks about being outside and having fun and good times. When he's not on TikTok, he's a family medicine doctor in New York. He built his original following on YouTube, by the way. His YouTube channel has 5.5 million subscribers. People like these two guys are using TikTok for more than just entertainment. They're getting messages out there, and their audiences are paying attention. Audiences are looking for entertainment, just like Tara is, but they're also looking for information, and they're looking for information from sources they feel a connection to and that they think they can trust. When somebody's on TikTok, their audience assumes that they're not going to tell them anything that isn't true. And that's why it's so powerful.
And remember our friend Dion from Delaware? He's a great example of a TikTok creator who has built a nice brand and following. His 147,000 followers enjoy his posts about what it takes to succeed as a college football player, how he stays in shape, and what he does for fun. He's relatable, he's regular. Real Nurse Kelly, on the other hand, she's the one on the right. She's a real nurse, and she's also a former Miss California who has almost 40,000 followers. Her content skews towards lifestyle, which is not surprising as a former Miss California. She also talks about what it's like to be a practicing nurse, gives advice on fitness and healthy living, and inspires her followers with her positive outlook on life. They're great examples of the kind of TikTok creators that you might want to use to reach your audiences.
All right, thanks, Amanda. Let's take a look behind the scenes, what it takes to get on TikTok.
It's pretty easy to get on TikTok, actually. There's three main ways that you could get started. You can partner with a creator like the ones we just showed you. That's a great way to start. You can start your own channel and post to it, a lot like you do if you're on Facebook or Instagram. Or you can actually create and run your own content as advertising, and you don't have to be an active TikTok user to do so. A lot of people get into it that way because they just don't have the time or the inclination to really run their own organic channel on TikTok. So starting with a creator is a great way to go.
So TikTok actually offers tools like this, the one that you see here, to make it really easy. Much like influencer marketing, you can filter based on a variety of factors. TikTok then shows creators who fit your description. Once you select and hire a creator, they do most of the work. They make the content, they post it just like influencer marketing, they post it to the platform, and they'll be the ones to encourage engagement. If you want to make your own content, that's also pretty simple, and TikTok offers good tools to help you with that too. This here you see is a video editing tool. They actually have templates already loaded in there, but they also have other ways that you can upload fresh content that you create. So it's nice. It's very user-friendly. If you've ever used like iMovie, it should look really familiar. And this is where you can manage and optimize your ads. So similar to other advertising platforms, Facebook, even on Google, you have the options to control your spend and choose different kinds of campaign objectives, and it'll give you a prediction of what kind of audience engagement you should receive. It's a really great time to explore TikTok. This platform is hungry for advertising. As you know, they're exploding. People are jumping on there. They really are offering great service right now. They gave us our own rep who we can actually call with questions anytime we need. And if you get on there, they'll probably give you one as well.
Sounds good. Sounds good. So we're going to end this presentation with showing you some TikToks that we actually made at WAX over the past month. Tina from the Daisy Foundation is going to set this up.
Hey everyone, I'm Tina Barnes-Caraher, co-founder and vice president of marketing and communications for the Daisy Foundation. Since you're healthcare and hospital professionals, you're probably aware of our Daisy Award for Extraordinary Nurses. It's well known within the industry, but not so much to the general public. Now more than ever, nurses need to know how much they're appreciated. We recently upgraded our website, so now it's possible to nominate a nurse for the Daisy Award online. This turned out to be a big deal during COVID, but we needed to get the word out. WAX helped us create a digital direct-to-consumer campaign, which included display ads, paid search, geofencing, retargeting, and paid social ads. The campaign has been a great success so far. We've almost doubled the amount of nominations being submitted each month. This is great and exciting, but it's just the beginning. In light of all of this new activity and during this crazy time, we really wanted to do something special during Nurses Month this year. WAX suggested we try TikTok, a platform we have never used before. You know TikTok, but you probably don't think of it as a place to talk about the importance of nursing. We didn't either. I'm going to turn it back over to Wax now so they can tell you how they convinced us to try TikTok.
Here are a few examples of some of the TikToks that we made for Daisy. I'll switch over back into the video. So we did a few different formats here. We started with the traditional kind of advertising, you know, with the Daisy, more on the safe side as we usually would for our clients. And then this is an example of leveraging content that's already popular on TikTok.
Hey, have you heard about the Daisy Foundation? No, it's not. It's this great organization that lets you honor nurses. I was thinking about honoring the nurse that took care of Mom. That's cool. How do we do that? It's pretty easy. Just go to daisyaward.org and fill out the form.
This is a great example. The TikTok we're getting ready to show is a great example of a TikTok trope. And it's awesome to jump onto trends on TikTok. There's all kinds of stuff going on. Instead of trying to invent your own thing to get attention, there's a lot to be said for doing something like this. Pointing at words, surprisingly maybe, is a thing on TikTok. So here's a version of that.
We also did some stuff for Nurses Week.
Yeah, we had a lot of fun with these. We put the whole agency to work on them. And we also jumped on some trends for Nurses Week. Amanda, why don't you go ahead and let all three of these play, and then we'll try to wrap it up and get to a few questions.
Don't worry, everything's gonna be all right. Nurses are kind, beautiful, and sweet. I want to be a nurse when I grow up.
Oh, it's Nurses Month. Oh boy, I better do something really good. I better be a very, very good boy. Hang on, look. I am such a good boy. I want to say thank you to all the nurses. I'm such a good boy. Look at me. I am so good.
Not surprisingly, the fun TikToks got the most engagement on all those examples that we just showed you. We're still testing out things that work, and what we're finding is people really want to be entertained first. Not that surprising. And if you entertain them, then they will pay attention to you, and you can kind of sneak some information in there on them too. We want to wrap up with another TikTok that we made. This one's not even out in the world yet. Amanda, if you can go back to that one. This is for a campaign for Community Care Plan, who you heard from a minute ago. And it's part of a bigger effort that we call Abuela Says. Now, for those of you who don't speak Spanish, an abuela is a grandmother, and grandmothers are notoriously bossy. So here's a quick example of something that we made that's going to help to promote this whole campaign to the audience on TikTok. Go ahead.
Ay, qué cansada estoy. I'm going to call my daughter because I haven't talked to her in so many days. Okay. Ay, Anita, qué bien te ves, mamá. ¿Y cómo está el bebito? Veo, I haven't seen him in so long. You never bring him over. Ay, Robertico, my grandson. How is he so skinny? Did you feed him bocaja? Because I can give him bocaja because he has to fatten up.
Abuela says a heavy baby is a healthy baby, but that's not necessarily true. A heavy baby can look cute and nourished, but research shows overweight babies are more likely to turn into overweight adults. To reduce that risk, make sure your child is within the recommended weight range for their age. Want to know if what Abuela says is always right? Visit ccpcares.org/Abuela Says to view the 5-part video series.
I love Abuela. I could watch her all day.
We're almost out of time.
Yeah, so we wanted to leave a few minutes for questions. Looks like we're not going to get to that. I understand there's a discussion board inside the portal. I'll stick around, and maybe Amanda and Bill can stick around too. We'll try to answer questions there as best we can. But a few things to keep in mind. I know this is a lot of information. Keep some of these things in your head if you're ready to get started with some or all of these. None of these work on their own. They need to be part of a larger strategy. Use them to amplify other things that you're already doing. And as we've mentioned a couple of times, start with the audience. Think about who is the audience and what kind of tactics or what kind of messages or what kind of influencers or what kind of TikTokers would make sense for them. And then just use the available technology. People have been asking about TikTok and how to get started in the chat. TikTok has great tools, so you can go investigate that directly with TikTok. And finally, if you need a partner, if you have an ad agency or a PR company, they can probably help you get started. And a lot of these platforms have good help available too.
Or drop us a line.
We're happy to help.
Send us an email.
How could people find us, Bill?
They can find us at waxcom.com.